providing an outlet for the voice of people to be heard. That's the goal Representative Matt Hall has set as he chairs the Joint Select Committee on the state's response to COVID-19. Representative Hall says the committee has heard Michigan people tell their stories during a series of hearings. This week, committee members heard from officials from the Michigan Department of Licensing and Regulatory Affairs, and Representative Hall says they probed for answers to the questions that people are asking.
You know, this is the first time that the public has had that opportunity to have their voice heard for many of these small businesses. And so that's why we presented this forum, because if LARA and these other departments of government are not serving as a voice for these people, if they're not advocating to the governor, we have to figure out some other way.
Representative Hall asked Department of Licensing and Regulatory Affairs Director Orleen Hawks about last week's committee testimony from salon owners that they had submitted a plan on May 21st for reopening safely and sensibly, but never heard back.
You just heard a lot of frustration last week from some of these small business owners because they submitted this plan. They saw other industries reopen that didn't have a plan in place. What do you think of that when you heard that?
While I do feel the frustration, we all want to get back to some normalcy, but there are mitigating factors that we have to take into consideration that sometimes are beyond our control.
Representative Julie Kelly followed up on the work group issue.
My other question had to do with the work groups. And now that guidelines have been established and safety standards are in place, would LARA support the continuation of your licensees should we see a resurgence?
Those decisions are not made by LARA. In terms of the decisions to open or close the state or to rescind or to extend EOs, and that's not our place.
Committee member Senator Kim Lasada continued to push for answers about COVID-19 patients returning to nursing homes.
I'm trying to understand the rationale behind COVID patients going to nursing homes. Who determined that, if you can answer this, who determined that it was okay? I mean, knowing that you can't go to the emergency room with symptoms, knowing you need to stay home if you have symptoms, don't go around people. Who determined that it was okay for a nursing home patient to go from the hospital back to the nursing home?
That decision was not made within LARA. I believe that's Human Services, Public Health makes those determinations.
Representative Jack O'Malley told Director Hawks that construction in his northern Michigan district has been harmed by confusion and a lack of clarity coming from the administration and state variations from federal standards.
The federal government had guidelines. Other states were opening up. Were you involved in any of that discussion? And if you were, can you share with the thought process on maybe why the federal guidelines weren't adopted for construction and that whole process? Because, again, my district, the weather broke. Everybody was ready to go, but they were held back for, many believe, a very long time.
I hadn't been in those conversations. I haven't had those conversations. We were not involved in that.
Okay. You guys do oversee licensing and rules and whatnot in construction, correct?
Yes.
Okay.
We'll be back next week with more stories from the JSC. If you have a story to share, please visit mycovidstory.com and share your testimonial.